The men's movement with our host, Dr. Jack Rocco. Dr. Jack, how are you, man? And you know what? You are putting together this dream team for your clinic, aren't you?
We are. It's exciting. I think most people I talk to about it like the idea. Everyone agrees that men are underserved in the medical community. Men are shy. Men have whatever issues with admitting to some physical frailty or reaching out for help. So I think that's a universal, and we hope to break down some of those walls and get men to come in and just addressing the issue. When we met with John Sanders, we talked about the idea of, there was a riddle or a problem where someone says you have two dogs, one that's in the dark and one that's in the light, and which one will survive? And the answer to the riddle is the one that you feed. And I think that's really a lot of our message. If you're having issues and you don't feed those issues, you don't feed those needs and desires, whether they be physical, emotional, mental, they're going to come back and burn you. So we're here to draw attention to men's issues, lighten the stigma of them, and get guys to go in and see physicians. We drudged through the Knife and Gun Club of Temple during the crack wars, and we saw a lot of trauma. We worked together in a lot of stressful situations. And we had a great group of 4 guys in our year. And like I said, despite high stress, high intensity, daily grind, the 4 of us, can you think of a fight that we ever had, John, that was anything more than a little scuffle?
Involve us. Yeah. Never involved everybody. It's a lot of blows.
Yeah, and I can remember you wrestling on the ground with one of our senior residents. We had some battles with our senior residents as they were trying to beat the heck out of us and teach us our trade. But yeah, we had a great group, and I attribute a lot of our success to 2 basic rules. Like if there was a problem with who's going to do some piece of scut work, if there were 2 people involved, we would do rock, paper, scissors.
Right, Rochambeau.
Right. Rochambeau. That always solved the problem. And if there were 3 or more that were involved, we would do the old finger to the nose rule. The last guy to touch his nose had to do the task. But I want to welcome John Lehman. John is an orthopedic surgeon. He did a fellowship in sports medicine, but you do a lot of general orthopedics now, John.
Mostly at this point in my career, shoulders and knees. I back off of hips and foot and ankles.
Great. Now, John, we're going to talk, I'll let you introduce yourself, John, however you want to highlight yourself and your career and your practice. And then we're going to go into focusing on shoulder issues, because I think that's a common issue, particularly amongst men who are blue collar, physical workers, or athletes, former athletes. So we're going to talk about that. But go ahead, introduce yourself, John, and welcome to the Ultimate Men's Movement.
I feel very privileged to be in the Ultimate Men's Movement. I consider myself an ultimate man. I have around you, Jack. Man, how can I beat the introduction you already gave me? I'm from Pittsburgh as well as you guys. Still live in the Pittsburgh area, practice in the Pittsburgh area. Did my undergraduate at Allegheny College up in the always sunny Meadville, Pennsylvania, up near where you grew up, Jack. Always in Erie, right?
Yeah, the only thing less sunny than Meadville is Erie.
Is dreary Erie, yes.
A mistake on the left.
Then I came out to Temple, like you, went to medical school and did our residency out there in the Knife and Gun Club. Great times were had by all. And then I went and did a sports medicine fellowship in Kansas City, working with the Kansas City Chiefs, who were not as good as they are nowadays, but they were pretty good back in the day. And then back to Pittsburgh again, where I've been practicing in the Pittsburgh suburbs now for, close to 30 years.
Yeah.
So my story, I'm sticking to it.
Yeah. It's great to see you here, John. We need to do more face-to-face. It's been a few years since one of our best times was Super Bowl. Which Super Bowl was that? Super Bowl 30?
It was a Neil O'Donnell fiasco for the
still don't want to remember
Portland. That was Portland. And then we were on to Tampa. We actually went to the game in Tampa.
We did get together and went down to Tampa together and watched the 99-yard touchdown interception. Yes.
Yeah. That was great.
And the catch, if you remember, Santonio Holmes had the catch.
Yeah. Oh, and we were in the absolute worst seats to see the catch. The catch was on our side on the opposite end zone, but we were there. Yes. We shared in the excitement, whether we got to see it or not. So let's get into
the tickets.
Pardon me?
After I almost lost the tickets. Remember that? I left the tickets.
Yeah. James Harrison's, didn't his agent get us tickets or something?
Yes, yes.
Yeah.
James Harris's agent is from Beaver County. Yes.
Yeah. All right, John, let's get into some nuts and bolts about shoulders. Shoulders
Right.
the shoulders are the most mobile joint in the body. And as a result, a lot of the issues with the shoulder come to stability. As you increase your mobility with the shoulder, you sacrifice some stability, as opposed to the hip, which is more stability and has less mobility. So they're opposite joints in that respect. But a lot of the pathology that comes along with shoulders is related to that, I don't want to say imbalance because it does what it's supposed to do, but that hypermobility versus poor stability. So what would you say your most common ailment diagnosis is in regards to the shoulder that you see in your office?
In my practice, it's a combination of the younger people having labral pathology, which is the cartilage that surrounds the shoulder, and the older people having rotator cuff pathology, which is the tendons that drive the shoulder. So between those two things, that's the most frequently diagnosed and frequently treated problems in my practice.
So you would say the younger guys are probably more traumatic, whereas the older guys are more of a degenerative type wear and tear?
Yeah. Degenerative problems with a straw that broke the camel's back on top of it. Some type of lifting something, working out in the yard, wife makes cut the grass, lift something, carry something, boom, rotator cuff.
Okay. I have a story on that.
Yes.
I don't know if Dr. Jack told you my background. Former professional wrestler. So I blew out both my shoulders, I think I did. I never got surgery on either of them. And I'm in pretty good shape, ability-wise. I think starting doing the yoga for Diamond Alps Page Yoga has given me more of the ability to reach up where I couldn't reach at all before, because yoga helps tremendously. But there definitely, I don't know when I'm getting older, I'm 52, but I never got any of those done, but probably just maybe tore a rotator cuff potentially of both of them in pro wrestling. And those days I can't really swing a golf club. Until now, I started with this whole thing, but so I know shoulder pain. But that happened really young.
So you healed primarily through rehab, correct?
I guess the rehab was just now later when trying to make a comeback into the ring last year, and then life happened, and I don't know if I'm going to make a comeback now. But the best thing was finding Diamond Dallas's Page Yoga, DDPY Yoga, because it's a yoga that's cool for men. That's something you need to definitely promote.
I'll have to look into that because I am yoga and cool for men together in a sentence. So that's something I want to look into.
Yeah, but it helped I can reach up like this. Couldn't do that ever. And that's part of the whole, you're going to grab the ball, put it down, put it into a T. I'm sitting, and then you take it all the way up into a Hulk position like that. And it really helps your
and that's
range of motion.
Yeah, that's a great point. And it goes along with what we've been saying as far as with the shoulder, it's a mobility issue. So that if you have an injury and your shoulder is stretched out, and it's the stretching out or the injury that causes a little bit of instability, the best way to treat that is with strengthening, rehab, strengthening, range of motion. So yeah, a lot of shoulder injuries can be treated non-surgically with rehab, injections. What do you do for that initial patient that comes in, whether they're old or young?
Clearly, the mainstay of treatment initially is non-surgical, right? Whether it be therapy with cuff strengthening, scapular stabilization exercises, like he's talking about, with dynamic stabilization, like yoga, Pilates, those types of activities certainly help a lot. The surgical treatment is reserved for significant tears of some structure that needs to be fixed. Jack, you're not a glorified carpenter, or you were, where something's broken, we go in there and fix it.
That's where our skills are best utilized. We're doing a comprehensive view, so we'll brush over the non-surgical.
Rehab until proven otherwise.
Exactly.
I'm still, playing wrestling. Are you like Jimmy Superfly snooker wrestling we talking about?
Oh, yes. The Rock wore my knee pads in 1997 before he was The Rock. I wrestled in Jerry the King Lawler in the Mid-South Coliseum. I'm a legitimate 6'10". Right now, probably 284 pounds. I don't look 284, but yeah.
On this little picture that I see is not there yet.
Yeah, but John, the interesting thing is, if you remember, what was that from Fletch? He's 6'10" now, but he was 6'12" with the afro back in.
Fletch, we got it. Yes.
Wasn't that from Fletch? 6'12".
Fletch reference, by the way, but
oh yeah, I've got plenty of those. So anyways, so John, so now you've failed conservative care, whether young or old. What do you go to an MRI right away, or what's your diagnostic modality of choice?
I'm an MRI arthrogram guy. I really do. The MRI arthrogram is my ability to read the studies. We do have musculoskeletal ultrasound available at our health system. I don't like it as well. It's a fallback for guys who can't tolerate MRIs for various reasons. Definitely the MRI arthrogram with the dye injection into the shoulder is the imaging modality.
The contrast is going to interdigitate between any of the fibers that may be torn.
It comes through a hole in the rotator cuff. It'll come between the labral hole, and it can determine a tear versus just scar tissue from a previous injury, that kind of. Yes.
Yeah. I use the term fraying versus tear. That sometimes, depending on the radiologist, depending on the read, you may see rotator cuff tear, partial tear. In my simple Erie, Pennsylvania mind, I see like a pair of frayed jeans, so that it's not really
big rope that's frayed but not torn yet. Yes.
So there's a whole spectrum of pathology that comes out. But say you've got a young guy with a labral tear, or with a definite detachment of the labrum, or an older person with an actual detachment or full thickness tear of the rotator cuff. What do you do in those instances?
It becomes a surgical problem then. You've got something broken, you go in there and fix it. So then it becomes, again, in my world, this is all done arthroscopically. You stick a scope in the shoulder joint through a couple of puncture holes, and whatever's torn, you repair, put stitches into it and sew it back together again.
Now, do you use anchors, John? What type of fixation do you use? Knotless anchors? What do you
practice for both rotator cuffs and labrums? Yes, you use a bioabsorbable, these that go away over time, not metal. It's anchor technology. Try to tie fuse knots as possible to minimize rubbing of knots in the area of the shoulder joint. Yeah,
because these sutures, they are strong sutures. That I would say that if you're pulling on this suture with your finger, you're likely going to detach your finger before you're going to tear the suture's not going to tear. Your finger will come off. They're made of Kevlar or a highly braided suture, correct?
Kevlar might be an exaggeration, but Kevlar, yes.
Okay, yeah.
It's not going to break.
It's not going to break.
What do you see when you know that it can't be repaired? Just that you'll just know your shoulder.
Meaning that something can't be repaired
non-surgically.
Typically, where the tendon comes across and is supposed to attach, if it's detached and retracted, it's not going to jump back where it came from. The muscle has an elastic property. I describe it as like a rubber band on a little bit of stretch attached to each end. You cut one end, it pulls back. It's not, you have to manually grab it and pull it back and sew it down. It's not going to repair itself.
And especially if it's old, John, you may have to release some scar tissue in order to get it to mobilize. There are times you go in there and you're pulling and that tendon's going nowhere till you start to release and free it, correct?
Correct. That's right. You have to go in here and clean it up and pull it over and sew it back down and get into the bone where it came from. Or in the case of the labrum, it detaches, and now that's where the dye goes through. That's where the dye in the MRI arthrogram comes into play. You see it go through the tendon or the labrum. You have to go in there and sew it back down again where it came from, like a meniscus in the knee. Same analogous structure.
Yeah. Now, John, you treat the full gamut of shoulder injuries. So say you get in there, like I said, you have labral tears are usually repairable. There's techniques you can do to repair a labrum or accentuate a labrum. But with a rotator cuff tear, there are some that you get in there and you can't fix them. They're too old, they're too chronic, they're too retracted. The muscle may be atrophied where, even if you can get it back, the muscle's not working. What do you do in that case when you have this irreparable tear, something that you can't fix? As good as you are, John, you still can't get it back to where the Lord wanted it to be. What's your option in that case?
You're going down the road of a reverse shoulder replacement. There's shoulder replacements where we go in and take out the ball, put in a new ball, smooth out the socket, and put in a new socket. And those are great operations, but you need a good rotator cuff to drive the shoulder. If you don't have the rotator cuff to drive the shoulder, then a shoulder replacement is not going to work. In those circumstances, we do something called a reverse shoulder replacement, where you flip the ball on the socket side and the socket on the ball side, and you use your deltoid muscle, which is the muscle on the side of your arm, to drive the shoulder in place of the rotator.
Now, why does that work, John? Why would you want to go against God's design? God put the ball where the ball is and the socket where the socket is. But you're saying with the reverse, you're flipping the socket becomes a ball and the ball becomes a socket. Now, you mentioned about the deltoid, but why does that do that? Why does that work?
It's all physics, Jack. It's all in physics. You take the ball and put it down where the socket is. You're moving the center of rotation of the ball socket joint down and in, which gives the deltoid a mechanical advantage now to raise the arm up, whereas before it was pulling the shoulder straight up. So it's all physics these days. Lever.
I knew physics. I knew
you're from engineering. I understand it. Couldn't get it. Us Pittsburgh guys, we get it.
I knew physics was going to come into this somewhere, but
yes.
And when the reverse shoulder first came out, it was pretty controversial. A lot of the old timers,
Germany.
Yeah, the old timers who did your traditional shoulder replacement poo-pooed it, and I think there were a lot of complications early on with reverse shoulders. Is that true?
Like lots of new things. Yeah, they started off good idea theoretically. There were a couple complications. Scapular notching was one of them. Dislocations was one of them. But they figured out the mechanics of it. They've tweaked the prosthesis to a second generation, third generation, to where the complication rate has gone down. The improvement and surgical results have gone up. So where it's a good operation.
Yeah, because I know it's, especially when we were in residency, it wasn't a thing. The reverse shoulder wasn't.
Wasn't even invented yet, barely.
Yeah.
Not in the United States.
No. And you're right. And now it's to the point where a lot of times guys are preoperatively, if they've got a tear that looks irreparable, they'll just preoperatively go in for a reverse shoulder. And what are the results do you see better results, worse results? Is it a salvage procedure still, or what kind of function can you expect from a reverse shoulder?
I would tell you, I wouldn't use the words better or worse. I would use the phrase more predictable. A shoulder replacement that's done well in the right patient with the right rotator cuff, et cetera, does great, but just not very predictable. There's lots of people who have MRI, okay looking rotator cuffs that aren't very functional, or commonly they have a tear a year or 2 years later, 3 years later, the rotator cuff tears. Now they're stuck with a shoulder that doesn't work. So it's a more predictable result, Jack.
Yeah.
Still good. Pain control's good.
Yeah. And like we talked about earlier, the shoulder it's a balance joint. That balance between stability and mobility, and you need good structure. You need a good intact glenoid and humeral head, but you also need a functional rotator cuff. So, it is you remember Moyer, all those patients come in with sore shoulders. That was a diagnosis back then. Sore shoulder.
Classic symptoms of a sore shoulder.
Yeah, he's got a shoulder and it's sore. So that was the extent. They used to also call before shoulder arthroscopy, they used to call it a black box. So it's like Schrodinger's shoulder. You don't know what you're going to find when you go in there. But arthroscopy has really allowed you, and MRIs, we're that old where MRIs weren't that common. But now with a scope and with the quality of the MRIs, and like you said, the MR arthrogram and ultrasound, you can really nail down your diagnosis pretty well before you go in. So things have changed dramatically. But what do you take age into consideration? Would you be more aggressive with a repair in a younger patient versus older patients?
That has changed significantly in the last 5 years. It used to be 75 years of age was the inferior cutoff for reverses because of the potential complications. And in the past 5 or 6 years, that's went from 75 to 70 to 65. We're doing now in 55-year-olds with irreparable rotator cuff tears. And the results are playing out that they're doing fine. Is there an inferior, lower level age? Yes. I don't know what that is. Honestly, it depends on
we probably don't have the follow-up at this point. We don't have, maybe in reality they do.
Frankly, as well as I do, there's 40-year-olds that are going on 70 and 70-year-olds who look like they're 50. So
yeah, exactly. That's an interesting point you're making. That's the truth, that people older are investing in their health more than young people are even spending time in it. The big whole biohack. There are young people in Silicon Valley, but we're not seeing a lot of them in Pittsburgh. They're doing this whole, we're going to go reverse aging. We're going to continue to improve. We have a long life ahead of us and we're going to enjoy our lives now because a lot of things are gone. I can be this way. So age equivalency is a difficult challenge because some people are like, I want to improve my body the older I get, while others are winding down. And then there's younger people that don't even want to take care of their health at all.
And then you also have the
Jack's ultimate men's clinic. Do you want to be 60 going on 80, or do you want to be 60 going on 30? That's
That's true.
That's the whole purpose of the men's clinic. You nailed it, John. You know that you've both been in great shape. You're still an avid cyclist, and you always seem to have a bunch of. You still golfing? What are you doing physically with yourself, John?
Yeah, you named it. The golfing and a lot of biking. Don't run like I used to. Parts are wearing out a little bit. I need to get in to see you. But,
Show me that funky finger of yours, John.
Oh yeah, I got a crooked finger. You're not gonna like it.
I love it. Would you let this guy operate on you? I would, but I'm just saying, when you look at that,
Star Trek finger, Jack.
You can operate around corners, John.
Those are no man has gone before. Yes.
So, Jack, what is your hope with this collaboration?
With John, I think we're in the same boat. A lot of us both, not only do we treat a lot of these aging conditions versus when we were younger, and we're like, what are these old guys complaining about? It's not even torn. These old guys are just whiners. And now that we're the old whining guys, we're like, suddenly it's important to maintain. And John hasn't expressed some preliminary interest in doing similar things. We've always done anti-aging. Orthopedics has always done anti-aging, but from the musculoskeletal standpoint. But I think orthopedics is changing a lot too, with the importance of nutrition and collagen and your general wellness, your A1C, your visceral fat. Orthopedists are not your standard carpenters as much anymore. We're becoming much more chemists and understanding and appreciating the natural elements of healing. Do you find that, John? You talk to your patients more about general health and weight and all that now?
Absolutely. And we've become less narrow, blinded, focus on that bone right there or that joint right there, in more big picture kind of situations, talking about, I just fixed your rotator cuff. Well, what about your other rotator? What about your knee? What about your spine? What about this? And it's looking at the whole big picture. And Jack and Nero, I'll tell you, the older I get, the more the definition of old gets higher. Before, a 50-year-old was like almost dead. Now, since I passed that a while back, I'm looking at how do I maintain a healthful, youthful health span, not lifespan, health span, maintaining my ability to do what I want to do longer and longer. And that's where
I'm really into the biohacking.
What?
Yeah.
John, David Asprey, I'm studying. I'm very interested in all these things. And honestly, there are a potential. I don't know how many people want to live forever. There's going to be technology that potentially extend your life by double in the next 10 years with where AI is going, different things. I'm seeing this straight out. I got to look at who the guy was talking about it, but who wants to live forever? I do, because I want total world domination. So there you go. A Pittsburgher.
One podcast at a time.
What just the businesses. If you look at study of media companies, if they own those media companies, who are the strongest people are the ones that know everyone. And that's the goal. And that's why you got to live longer, stay healthy, eat healthy, and reverse that aging process. And that's why you got to go to the Ultimate Men's Clinic. And then you got to check you out too, John. Go ahead, Dr. Jack, for your last question before I ask Dr. John where we can check him out.
Yeah. John, you made a great point about people are coming in with shoulders, knees, hips. Do you find that men in general come in later in the process? They suck it up, buttercup, until things get worse, and then you have to really catch up? Go ahead.
They could frustratingly late. A lot of times, the speech that I give to people is unlike hips and knees that are worn out and you replace them, right? You inject them, you milk them along until they can't take it anymore and you replace it. The shoulder specifically, and the rotator cuff specifically, there's no replacing it. You need to fix what's there while it's still good, right? And those irreparable cuff tears and the reverse shoulders that we talked about are great, but not nearly as good as fixing the native tissues. And so you need to come in when you start having the symptoms, or even before the stretch. But when you're having the symptoms, not waiting. And like you've alluded to in other podcasts that I had the pleasure of listening to, you don't put it off for years because you got to go to work.
I did it until I finally saw the value. I guess entrepreneurship has made me say, better stay the course. Look at the Bezos of the world and live so you can maybe make it and break it someday and make it the opportunities that come if you're going fast and hard and not looking at the long-term futuristic point of view, you're going to miss out. You're going to screw up. You're not going to show.
Right.
John, when can people, here's the final, how can they get a hold of you? And when are you going to open the Ultimate Men's Clinic Swickley? That's a totally loaded question. I'm going to put you on.
That's a totally loaded question because I have no idea what you even do necessarily. I know a little bit. So, a while yet. How's I say that? I'm up in Beaver County. I work in Heritage Valley Health System in Beaver. That's where our office is, in Beaver, PA. So, the Ultimate Men's Clinic, Pittsburgh/Sewickley. As soon as I can get Neil on board and get us set up.
Yeah, you know what I did is I went and became a trader. I live in Mentor, Ohio, right outside Cleveland, and they all want.
Okay.
Yeah, so that's where I ended up out here. But I like it. It's nice. And that's one place we at least have sunny days. That's one thing. I love living in Texas and having all those sunny days, except the summer. Here, at least, we have more sunny days than Pittsburgh. A lot more.
Right, John, what's the name of your practice, John? How can people get a hold of you? You want to have John Lehman fix your shoulder. How do you find him?
Heritage Valley Medical Group. That's what it's called. Medical Group Orthopedics.
Fantastic.
Thank you so much, John. I really appreciate you coming on and sharing your wisdom with you. You've gotten a lot smarter than you used to be.
Better looking too, I think.
Oh, we all have.
All right.
Right.
The ultimatemensclinic.com. Schedule a call with Jack today in New Bedford, Massachusetts. All right. Appreciate it, guys. Thanks again. That was a special simulcast Neil Higgs show on the Ultimate Men's Clinic movement. I want to say clinic too. Sponsored by the Ultimate Men's Clinic. Ultimate Men's Movement, guys. Take care.